Part 1. What does healthcare for all actually mean? A little over a year ago, I began a series called Healthcare in America, an attempt to understand how our current healthcare system was built and how it actually operates. Over more than 40 articles, we looked at the major parts of that system: hospitals, physicians, pharmaceuticals, insurance, Medicare, Medicaid, and the administrative structure that holds all of those pieces together. That series was about understanding the system we have. The question was simple: how did we get here? After spending that much time looking at healthcare in America, one thing became obvious. The healthcare debate often starts with the answer before we have agreed on the question. One side says the answer is more government involvement. Another says the answer is more competition and fewer restrictions. Another says the answer is something in between. But before we can decide which direction makes sense, we have to understand what we are actually trying to accomplish. That brings us to the next conversation. Where do we go from here? The phrase we hear most often is healthcare for all. It is a phrase that sounds simple. It suggests a basic idea that most people can understand. People should be able to receive needed medical care. The difficulty begins when we try to define what that promise actually means. Does healthcare for all mean every person has an insurance card? Or does it mean every person has access to medical care when they need it? Those are related ideas, but they are not the same thing. A person can have insurance and still struggle to find a doctor. They can have coverage and still wait months for an appointment. They can discover that the treatment recommended by their physician is limited by what their plan will pay for. Insurance can help people access healthcare, but insurance itself is not healthcare. That distinction is one of the places where the national conversation often becomes confused. Healthcare is the doctor, the nurse, the hospital, the medication, the treatment, and the people who make those services possible. Health insurance is the method we use to pay for those services. The two work together, but solving one does not automatically solve the other. A country can create a system where everyone has coverage and still face shortages of doctors, long waits, rising costs, or difficulty accessing care. Providing payment for health care and delivering health care are two different challenges. Once we understand that distinction, the phrase health care for all becomes a much larger question. Every healthcare system has to make decisions about what it promises, how it pays for those promises, and how it delivers them. For example, a system must decide what level of care should be guaranteed to everyone. Is the goal basic medical services, or does the promise extend to things like dental care, vision care, mental health care, prescription medications, and long-term care? Those decisions matter because every expansion of coverage also creates a need for more resources, more providers, and more funding. Then comes the question that every healthcare discussion eventually reaches: how do we pay for it? This is where many political conversations become oversimplified. It is easy to say that healthcare should cost less or that someone else should pay more. It is much harder to design a system where the money actually covers the care people need. Every healthcare system has a bill. The difference is how that bill is collected and distributed. Some systems rely more heavily on taxes. Some rely on employer contributions. Some rely on private insurance. Most countries use some combination of approaches. The question is not whether society pays for healthcare. Society always pays. The real questions are who pays, how much they pay, and whether the system produces the results people expect. There is another choice that often gets lost in the debate: who actually delivers the care? A healthcare system can be publicly financed without having every doctor and hospital operated by the government. It can also involve private organizations while still having strong government rules. These distinctions matter because when people hear phrases like government healthcare or private healthcare, they often picture completely different things. A system is not defined only by who writes the check. It is also defined by who provides the care, who makes decisions, and who is accountable when the system fails. One advantage we have in this discussion is that we do not have to design a healthcare system from scratch. Other countries have already tried different approaches. They have made different choices. They have experienced different successes and different problems. There is no single universal healthcare model. The United Kingdom, Canada, and Germany all provide broad access to healthcare, but they do so in very different ways. The United Kingdom uses a national health service model where government plays a central role in both financing and delivering care. Canada uses a single-payer model where government finances medically necessary care while many healthcare providers remain independent. Germany uses a regulated multi-payer model where private and nonprofit insurers operate within national rules. Each system reflects the priorities and compromises of the society that created it. None is perfect. That is an important point, because healthcare debates often become a search for the perfect example. Supporters point to another country and say, they solved it. Critics point to a different problem and say, that proves it does not work. The reality is more complicated. Every system solves some problems better than others. Every system creates trade-offs. The goal is not to find a perfect system. The goal is to understand the choices. That is where this conversation begins. Before we decide what America should change, we need to understand what we are choosing between. Healthcare is too important for slogans alone. It affects every family, every community, and eventually, every one of us. The question is not simply whether America should have more government involvement or less. The real question is, what kind of healthcare system can provide the care people need at a cost society can sustain while maintaining the quality and innovation people expect? That is where this conversation begins. In the next part, we will examine one of the most widely discussed proposals for changing American healthcare, Medicare for all. Before deciding whether it is the answer, we first need to understand what the proposal actually means, what problem it is designed to solve, and what changes would be required to make it work.